The topic that won't go away in the minds of Americans is COVID. Even though the pandemic is over, we still see reoccurrences of the COVID virus, and we see aftermaths of policies that were set in 2020 that seem to still linger. Kathy, I look at COVID now, obviously a little different than I did in 2020 when we didn't know what was going on. From your perspective, what do you see as the aftermath of COVID now after these 4 years?
Well, I think it has affected people a lot more than we are collectively aware. I think during COVID, we were kind of encouraged to look at each other with suspicion, and as though other people became a threat, rather, even in children in schools. We're kind of taught you have to distance, you have to be apart. I think that affected our human relationships.
I do too, and I think the social distancing in particular, which is now, I think Dr. Fauci came out and admitted that in a House testimony that the social distancing didn't even have a basis in science. It was just their effort to try to, I think, get the attention of Americans to take it more seriously. And by doing this dramatic effort of stay 6 feet from each other, this would somehow suppress the transmission of the virus. Well, look what it did in human relationships.
I think psychologically, even spiritually, that was not of benefit. You were one of the first people who called that out while it was going on and said the mask thing doesn't make sense, the social distancing doesn't make sense. I mean, very few people were brave enough to challenge the narrative at that time.
Thanks. Although I tell you, the mail that we get, the emails, the texts and so forth, whenever I've criticized Dr. Fauci, are almost uniformly in support of him. And I think that's because there's a natural sympathy toward anyone in authority that was trying to deal with a dangerous spread of virus and not knowing the parameters of what it entailed. You know, how was a whole household of people going to die? Was this only for a specific few? And now we know, of course, that the elderly were disproportionately impacted. And in fact, the great majority of the deaths were people over 70. And so, yeah, I was frustrated about that. And I think Dr. Fauci gets credit for some of the things that he did do. It's tough being in leadership. I ran a state's health agency. We had 40,000 employees. So it wasn't an easy job, but I think job one is candor, and social distancing was a casualty of that because there wasn't really a scientific basis. And then they suppressed the Barrington Declaration, which just said, let's do focus prevention. So all of those, I think, added up to what we have now, which is kind of a mental health crisis. I don't think people trust public health like they used to.
They don't. And we can't forget that this put the government in your kitchen in terms of making your health decisions, something that should never happen. It didn't do any good for people's trust of the government either. And it knocked children's development back. It knocked teenagers' development back. Now, people are afraid to be in direct contact with other people. Those are some really serious social effects.
Yeah, I think the lingering effect is a mental health dimension, not the physical health. I think people are fearful now more than they used to be. They are reluctant to go out. People want to work from home. All the things that were inculcated by our government officials is the right response, that if you want to be compassionate, stay away from the bedside of the dying, stay away from the funerals, stay away from the weddings. All of these messages that were sent have, I think, had a lasting damaging effect.
I agree.
And I don't know what's next because SARS is now basically under control. People aren't getting the vaccines now. They're not getting the boosters because they know it's not going to necessarily do much for them, and it's certainly not going to help with the spread of it. So I think there's a lot of question now about vaccine efficiency. That's a real casualty too of COVID, is that now people question it. You know, we always, my wife and I, we always followed the vaccine schedule, but now there were doubts about why were we oversold on this vaccine and will they do that again? So I'm not sure how I'll feel about that.
I think there are a lot of people who agree with that assessment, and I think we're all going to take a little persuading the next time they come with a vaccine we have to have.
Yeah, and I think the mandates, the prohibitions of travel, all of these things may have an uphill battle next time. So we've learned some lessons from COVID, but I think until there's a real accounting for what took place, I'm not sure that people were ever going to trust public health like they used to, because they have to earn back trust.